Hi, my name is Advait Joshi. I'm from uh, MIMER Medical College. It is located in Talegaon, Dabhade, in Pune. I um, am from the batch of 2016 and I graduated in 2024. Pretty late, I know, but that is because I was gaining a lot of different kinds of exposure to clinical sciences and research. I did not fail any year. I was amongst the top 10% of my batch. Not even 10%, I would say 5% of my batch. And in internal medicine, I came second in theory, at least. So, you have to understand. So, I mean, uh, during my MBBS from MIMER, I went to LTMMC, and from LTMMC, I went to Tata Memorial right in my MBBS uh, to gain different experiences, different clinical experiences, different spectrum of clinical experiences. So within India, and of course, I've also been to corporate hospitals within my internship. So I've had both academic and corporate exposure. I have had rural and urban exposure. I have had what I will call general practice and super specialty practice exposure within India. In the US, I have also rotated and have had 8 months of clinical exposure, out of which 2 months I've given to private clinics. 2 weeks I gave to a community or a hospital, an urban community hospital. 2 weeks. Then I gave 1 month to a rural community hospital in the US. I have given 10 weeks to an Ivy League institute, and then 8 weeks to a university based hospital. So about have had a lot of exposure to clinical sciences from in two different countries and in different settings. So with this background, I think it is. I just have had multiple realizations about the kind of medical education we should be aiming to get in during our MBBS, right? And the reason that I primarily like to concentrate on MBBS students more is because MBBS students have the time, have the if they are able to utilize their time more efficiently by the time they graduate, they will become way better doctors than the doctors passing out right now from their with their MBBS degree. And the approach that I would like to give is that you should have the mental capacity. I mean, and it's mandatory. I mean, to be honest, this is not a choice. This is not or. This is and. This is a plus here. Okay, so research is a mandatory part of our education, and research has to be incorporated with the clinics. With the kind of This is the kind of mindset that I got at Tata Memorial Hospital and in my US clinical exposure. Of course, not all US hospitals followed this rule, but many did. Like this rural community hospital did not actually follow this rule. These two private clinics that I rotated in did not follow this rule. But the urban based hospital did, the Ivy League hospital definitely did, and the urban hospital, the university hospital that I rotated in, that also did. Right. So there has to be a bigger part of research than what it is right now during your MBBS education. And I wanted to make a video on this because I feel beyond exams, I mean, if you remember that NEET PG, USMLE, PLAB, all these are just pathways, they are not your aim, they cannot be your aim. Like, aim has to be something bigger, grander in scale, I think. It has to be, like, I would say, aim your aim should start with the question, what kind of doctor do you want to become? Right? What kind of doctor do you want to become? Do you want to become like a person who relies on old data, something that you have read from textbooks, and then use that in your clinical practice? Or do you want to keep on upgrading and become better and give better care to your patients? So the choice is yours. There's no right and wrong in this. It's a personal choice, I feel, a lot of the times. But I think um, uh, patients, I mean, I think from the patient's point of view, I think when you start incorporating evidences in your clinical practice, right? We always claim that our field is a evidence-based practice, right? Like, as compared to other medical or whatever they want to call themselves. I don't want to get into that mess, but we call ourselves evidence based, but we never actually learn to incorporate research into our clinics. And I wanted to just make a video on that. So, what can you do during your MBBS such that you can at least have a bigger exposure or a better exposure to research than your clinics? In India, we don't have a problem with clinics. We have a ton of patients. We have, like, if you are from a government hospital, then you have like at least 800 to 1000 patients a day footfall. In MIMER, you'll have probably like 500 to 600, or maybe lesser, but 500 to 600 will be probably an good average to have per day. Tata Memorial will be equivalent to a GMC, I think. 800 to 1000 patients per day. Yeah. So in clinics, in terms of exposure, we don't really have a problem there. I think the problem lies in approach. Right. The approach is that I'll give you the typical story of any average MBBS student in clinics. First year is wasted in preclinical subjects. Second year, people get interested in clinics, right? But by the end, they again become focused on preclinical subjects. Third year is when your curiosity actually builds up and you actually start going to the clinics a bit more seriously. But again, you focus more on ENT, ophthalm, and PSM, or whatever, community medicine. And then by fourth year, you have these big mega canon subjects like medicine, surgery, OBGY, peds, ortho, right? All of these are like your bigger guns. And the thing is, this third year is the problem, I feel, in a lot of sense, because in third year, people who don't attend clinics, they only stick to these three subjects, right? And these are in second year, you read the foundational subjects like patho, pharm, micro, right? They are the foundational subjects to these subjects. And third year is a big gap year between second and fourth year, and by the time you reach fourth year, you start forgetting the second year subjects. And so I think third year is a good time to give USMLE step 1 if you were talking about an exam perspective, but I don't want to talk about this perspective right now. So forget about USMLE step 1, but I would really emphasize on really participating in clinics in your third year. Like, put major strong emphasis on clinics. Like, even if you don't know how to do general examination and system examination, third year is a good year to learn. And that is because after you learn third year, these things will become the most minimum amount of expectations from a fourth year medical student, right? So remember that you need to know how to take history, you need to do general examination, system examination by the time you come to fourth year. And then when you're in fourth year, the focus should be on reading the theory and then incorporating that into clinical practice. And this theory part I'll be coming to soon, right? But that is this normal general structure of things that is followed in India right now, right? And I have a problem with this, a big problem with this. I don't like this approach at all. And the reason is that you miss out on a lot of opportunities that will come later on. And your MBBS, the degree of MBBS will start mattering more if you at least try to incorporate what I'm trying to tell you what I will be telling you right now. So, so in the research, so the thing is, uh, uh, the thing is you cannot have a approach like this. So let's start from first year, right? So the thing is, in first year, no, first year has to be an exploratory year. First of all, it cannot be just about anatomy, biochemistry, and physiology. At the end of the day, you will become a general practitioner. You will not become an anatomist. You will not become a physiologist, and you will not become a biochemist, right? You will become a general practitioner by the end of MBBS. So, and first year has to represent that. It has to represent foundation. It has to be a foundational year, of course, but it also has to be an exploratory year. You need to go on an exploration and see. In the hospital, you need to go on an exploration and see what kind of cases do you get. What cases do you get? What do you get in CVS? What do you get in RS? Infectious. In your locality, what kind of infections, and it will change from season to season in RS and infectious, right? What kind of endocrine cases do you get? What cases do you get in ICU? Do you get snake bites? Do you get organophosphate poisoning? What do you get? So this approach, I am not trying to tell you that you need to start reading diseases up right from first year. I'm not saying that. I'm just saying you need to make a list of cases that your hospital gets, right? And when you have at least maybe let's say 20-30 conditions, 20-30 syndromes with you, right? Then your second, third, and fourth year starts with the foundation that okay, at least minimal number of cases that my hospital gets are these 20-40 uh, cases, right? So you have your entire the next 4.5 years, and in fifth year, of course, doing your internship. But you have at least 3 years after that where you can concentrate on learning these things. People learn on IMP. People want IMPs. People want. Uh, in our time, we used to call it marking. The questions that they will ask in the the exams. But the thing is, that is not important, not as much as this. If you have at least, if you start reading nephritic syndrome, Wilm syndrome, start reading transitional cancer, bladder cancer, basically, and then start, even the basics, when they start forming at a much earlier stage, by the time you reach fourth year, a lot of these things will just become a revision, right? And that is what I'm trying to tell you, that start making a list of cases, start making everything much more clinical. For example, I'll tell you a good example. In first year, we used to have this thing called tetralogy of Fallot, right? In embryology. Now the thing is, I used to always ask what is the point of TOF, and it took me 3 years more when I came to my fourth year to realize that TOF is an actual case that you see in pediatric wards. Till then I used to think TOF is just a theoretical concept. Now imagine if you're a first year student, you actually go in your wards and see a case of TOF in your pediatrics wards or in the pediatrics ICU, right? And you see the X-ray, you see the clinical features, and then you come back to first year embryology and read that subject. Your point of view completely changes. You start remembering things much more faster, and that is the point of having a patient in front of you, right? So I'm not even trying to tell you that you have to mug up these 440 syndromes right in first year. I'm trying to tell you, you should have an idea of what you are going to learn in the next 3 years. And so these cases, they play a bigger role. Okay, what kind of questions will you ask in history? These are the common kind of queries normal medical students gets. And I think the earlier you approach your clinical side, the better it is. Okay, now comes to research. The thing is, we are put in a throughout our MBBS, we are told that we need to read Robbins, we are told that we need to read Harrison's, we are told we need to read I don't know, Lippincott, right? And then KDT. But here's the catch: all of these books, right, they take a lot of time to get published. Even the new editions, lot of time to get published. And by the time they are published, right, they are actually always let's say like 5 to 10 years behind current the current knowledge, or I would say current knowledge is fine, right? Current knowledge in terms of research. So these things, they act as a good basic expectation, or you can call it basic background information to subjects, but they are not the end of it. You cannot just say, okay, I've done Robin, so I know pathology. Not at all. You know the basic foundational concepts of biology of that particular condition or of that particular chapter, but you definitely don't know pathology. So, so what can you do, right? Um, I would say, if you read, let's say, I'll give you an example. Let's say in your first year, right, you are reading, you're doing lower limbs anatomy, right, and you come across varicose veins, right. Now varicose veins is a surgical lower limb condition. Okay, and you will find a lot of stuff written about varicose veins in all kinds of textbooks. But what I want you to do is, I want you to go on the internet, on PubMed, right? I want you to go on Google Scholar, and type varicose veins and read the first 10 research papers that you find. Or you can also, like, there are options there where you can write high citations or low citations or latest or whatever. You can choose whatever option you want, whichever filter you want, and then start reading at least 10 papers on that particular at one such condition. Get into the habit of reading papers. I think that is something that we just don't have. um, and when you start reading papers, you will have you will start realizing that you have multiple problems. One is the English is hard, much harder, I think. The second is that it's a scientific language, right? And the third is that it has a lot of statistics. So these two things will require practice. But to understand statistics, I can, because statistics becomes a third year subject. It comes much later in your life. So to understand statistics, there are lots of Coursera courses that you can start watching right from first year. There are courses by John Hopkins, there are courses by Michigan University, there are courses by IIT Bombay, which you can apply to and start watching right from first year. The other thing is that in IIT Bombay, there is a quant research course which you can attend, which I did during my internship, which you can use to learn some good statistical methodology, right? And then there is the other thing of research exposure, where so a lot of Indians like to say that there is no research exposure in India or in Indian medical sciences or in MBBS, and that's not true. The thing is, you have to seek it out, right? And how do you seek it out? So of course you have the ICMR STS, the very famous. I myself was a research scholar in 2018 in ICMR. Then you can do an MPH internship and IISc Bangalore. You can do you can do a translational research exposure in IISc Bangalore. You can do you can also do program called SURE, which is called Summer Undergraduate Research Experience. Multiple universities across the US have this, but you can. There's one institute called KEX Institute, which you can apply to and get some research exposure there. You can apply to Tata Memorial Hospital. Like Tata always needs research assistants, and you can apply there and get some research exposure. Of course, there will be a lot of groundwork involved. Like they will ask you maybe to build a database. Sometimes they may ask you to do silly things that you may think is a waste of time. But if you stick around, they might give you better opportunities as time goes by. There's of course aims that you can apply to. Professors and aims are good researchers, and try to collaborate projects with them, and I think it helps a lot, right? So this is my biggest takeaway: start getting exposure to research, right? Start reading papers, start sort of attending statistical courses, and try to interpret your own data. Start making your own projects, right? During and the best time to do this is probably in your second and third MBBS. That is because fourth year is very serious, and fifth year probably you will be spending in doing your uh, postgraduate exams and stuff, right? So second and third year is the most freedom of all. Like it has a lot of freedom, and it gives you, it will give you, if you use it the right way, you might gain a lot of exposure to a lot of different kinds of research and clinics during that years. So this is what I just wanted to talk about. That this is something I did not do at all, but I wish someone had told me these things exist, and I wish you all the best. Hopefully, this was all helpful information to you. These are just my thoughts. I can be wrong, but I don't think I am. This because these thoughts have come out of multiple observations and rotations in different institutes and different levels and different forms of healthcare.